Hi, my name is Dr. Alex Slupczynski, and I'm a double board certified facial plastic surgeon. Welcome to our video blog. Today I'll be talking to you about the bulbous tip. The bulbous tip is an issue that many patients complain about. It implies the tip of the nose, this area of the nose, being too fat or bulbous. There are three different types of bulbous tips. The first type, the most common type, is the ethnic bulbous tip. The second type of bulbous tip is typically seen in Caucasian patients, where you have the skin is typically thin. However, there's an overgrowth, an overdevelopment of the lower lateral cartilages, which are the cartilages in the tip. And in that case, through an open rhinoplasty approach, the bulbosity of the tip cartilages can be reduced or essentially reshaped. This implies that the tip cartilages will be reshaped and also resupported using some cartilage grafts. It's not necessarily removing cartilage, but more of reshaping it. Once the new shape is formed, the skin is put back into place and the open rhinoplasty is closed. The next part of this video will show some graphic intraoperative photographs showing how I treat the cartilaginous bulbous tip. In this photographs marked 1 through 4, the first photo shows the bulbous lower lateral cartilaginous tip, and the outline is for a cephalic strip, which is a removal of the cephalic portion of the lower lateral cartilages. Then a dome division is performed, and the dome division is sutured with either 5/0 or 6/0 nylon suture. And a strut graft that has previously been harvested from the septum is then placed in between the medial crura of the lower lateral cartilages. After the septal strut graft has been placed in between the medial crura of the lower lateral cartilages, they are further sutured together with either 5/0 or 6/0 nylon suture, and sometimes a fast absorbing chromic is used. A septal shield graft is then fashioned from a harvested piece of septal cartilage placed in the midline and secured using either 5/0 or 6/0 nylon suture. The next photographs will show several before and afters of cartilaginous bulbous tip reconstruction before and afters. In this patient, we can see that this is a Hispanic patient. Cartilaginous bulbous tips are not exclusive to Caucasian patients, but tend to be more common with Caucasian patients. However, can occur within the ethnic population. This is another example of a Hispanic patient that had a cartilaginous bulbous tip, and restructuring of the tip cartilages reduced the bulbosity of the tip. Again, more common in the Caucasian patient, the cartilaginous bulbous tip is more prominent. These next several photos will show examples of before and afters of patients that had a bulbous nasal tip with restructuring with the techniques previously described. Thank you for watching this educational video on treatment of cartilaginous bulbous tip. Please be sure to like us and join our video blog for future videos.